What's up, everybody? Shawn here, back with another Live to Roll. Today, we're going to be talking a little bit about um, heart issues, heart disease, just heart health in general. So, if you guys have any questions or any comments like that that you maybe dealt with or know somebody's been through, please drop them in the chat. We'd love to hear from you. And Tom should be hopping on and joining us in a little bit. He was just coming from a doctor's appointment. But yeah, I am Shawn. I'm a C5, C6 quadriplegic from a snowboarding accident 21 years ago. Bobby?
Yeah, hey, what's up, everyone? Welcome back to another Tuesday. I'm Bobby Rohan, C56 quad as well of 35 years. And are we? We're in February.
Yep.
um, kind of lost on my weeks for the last couple of weeks, but yeah, next month it will be that birthday. So that life birthday, and welcome back, Viv. I feel like I haven't seen Viv in for a while, so welcome back. If it has, I'm sorry.
Viv's been busy doing a bunch of stuff, but she's actually going to come out and help us out, I think, on Friday and Saturday for the expo for a couple
Uh,
hours. So that'll be awesome. We get to see her in person and
Excellent, excellent.
hang out a little bit. And yeah, anybody that doesn't know, next month, March 7th, 8th, and 9th, is the LA Abilities Expo. So if you're in Los Angeles area, or honestly, even if you're not and you have the means to travel out for a night or two, like our friend Chad is coming out from Texas for one night to come see it. I think more to hang out than to see the expo. But yeah, it's a really cool event. Awesome technology, lots of cool stuff.
Mhm.
And actually, the day before the expo starts, we have Rolling with the Golden Oldies, which is Julianne is one of the exhibitor setups, and it's the day before the expo, so she's going to give a little bit of a behind the scenes at the expo. So stay tuned for that next month, guys.
Yeah, it should be good.
But yeah, so let's talk a little bit about some heart health and things, because one thing that we were looking up is that heart disease. Lots of different cardiovascular diseases and stuff are much higher, not much higher, but have higher probabilities and percentages if you have a spinal cord injury or even just mobility, any mobility type disability, which I didn't read enough of the knowledge. I'm not that well versed on it, but I think a lot of that is just due to a sedentary life, not doing as much cardiovascular, exercise and working out. So staying active certainly important.
Right. Well, and here's the thing. We don't associate spinal cord with that kind of things of heart disease because we're always battling the more obvious, our bowels, our bladder, especially our bladder. It's a constant, and then if it's not that, it's skin issues. So the last thing on our mind is our heart, and as we get older, that becomes a problem. Just like anybody else who's can be an unhealthy to a healthy person. Uh, Plaque does build up, and
Yeah.
one of the leading things that you hear in on commercials and things like that is movement is good for your body, keeps everything flowing, but we also have other different issues that puts a lot of strain on our heart, and that's for those who are anywhere from, and I've heard it as low as T6 and above, um, because of our dysreflexia and our blood pressure drops, and that's a lot of strain on the heart, back and forth, back and forth.
That's
So it's something that we don't think about, and probably something that your doctor, and I'll be honest, my doctor's never brought it up to me about that kind of thing, except after I had my issue last year, or now it's been 2 years, and finding out that I had dysreflexia so bad that I had AFib attack. So now according to my cardiologist,
yeah.
it's best that I take medication.
So is that what? Because I remember in the initially, I think I felt like they weren't exactly sure what had caused it, like all the fluid to build up and then
Yeah, well, what happened is when the fluid built up in my lungs, I couldn't breathe, and then so there was so much pain and swelling. in my chest that boom,
Caused
the
the
AFib
AD.
came. Yeah, because my blood pressure was off the chart.
Yeah,
And yeah, and
yeah,
until they were able to, what happened is they pulled out my catheter, and it was like a gush of water. I've never seen it just gush out. And so what happened is that there was so much fluid in my body that, one place that it needs to go, if you're not sweating, it's going to your bladder right away. And that was one of the things that when they pulled the catheter plugged or something, or just wasn't, it needed more room. And as soon as they unplugged my catheter, I gushed out for maybe 2 to 3 minutes, just all over the place.
yeah.
Now there was something else going on with the fluid in the heart, and I forget the official name, but it's not like, and I don't want to put anybody at worry. Um, uh, you're going to get dysreflexia, and that could happen to you. Most likely, you're not going to go into AFib. Most likely, you're going to be stroking out before you're going to have a heart issue because of dysreflexia.
Right. But I do think that it's a lot of stress on your cardiovascular system, especially someone like us with the like quad at our level that's sitting typically at a very low blood pressure, which I actually finally 21 years into my injury, Leah got me my own a blood pressure cuff. I've literally never, I don't think, maybe I had one early on. I just when the nurses came to change my catheter, I had home health or had they took that was as much as I needed to know my blood pressure. I knew it was low when I was low. I knew I had AD when I had AD. But yeah, I've been trying to do it. I screwed up today. I forgot to test it when I got out of the bed this morning. I've been trying to get like a baseline. Um, but yeah, that those fluctuations in our system have to be strenuous on the entire cardiovascular system. Um,
Mm-hmm.
and
Absolutely.
be aware of if you do deal with AD, autonomic dysreflexia at all.
Yeah, yeah, and um, uh, Quad Fragger, he said it best. I'm worried about long-term AD effects on my heart.
Yeah,
Um, so yeah, when you're constantly into that, yeah, it's probably something to ask your doctor. It's probably something that maybe to see a cardiologist, and that's the best way. You can find out. They can run EKGs, they can do ultrasound, especially if you're ever bothered by it, because one of the risk factors of cardiovascular disease is high blood pressure,
okay.
unhealthy cholesterol levels, diabetes, and obesity. The last two, most of is are kind of together. If the obesity comes with diabetes, but not all the time, not all the time. But and we were saying, when some of us are in a chair, um, we're not exercising as much, and it's hard to get a good cardio. As much as we want to get out there and be as active as everybody else, it's not the easiest thing. Weather plays into a factor. Finding the right gym plays into a factor. So many things comes into factor, but there's no excuse that you can't get on there and do and find online, especially YouTube channels, good ways to exercise in a chair.
Yep. Yeah, I mean that's something you actively do with the staying driven fitness. We can shout
Mm-hmm.
if anybody is interested to message Bobby, or we can even try to put that in, or just doing your own cardio activities. Anything. I actually was going to try to see about making just a good video for just how to stretch your arms and move your arms if you're just starting, like if you're new injury trying to build up a little bit of strength or don't have much strength at all and trying to get your blood flowing more. But yeah, it's super important. Like Bobby has said a bunch of times on here, you don't need to have heavy weights to do it. You don't have to have any weights at all to do it. Just moving your body. Um,
And really, you just need, like, this is 1 pound. Where am I? 1 pound of a wrist weight. That, yeah, put it in your thumb and wrap it around your wrist, and it velcros. It's, you can get these on Amazon. 1 pound. You go to town, do imic of jump roping, imic of cross punches, or just punching out. And there's something called tabata, tabata, tabata. Where you set a tabata for 8 minutes, and you go 20 seconds as fast as you can of punching out, 10 seconds of rest. That's a good little workout, and it's a cardio type of workout that anybody can do. Now, I get it that, our higher levels sometimes of anywhere from C4 and up, yeah, it's a little bit harder. And that's where that diet comes into a factor. One of the leading causes of heart disease is a high diet in saturation fats, trans fats, and cholesterol. So, you are what you eat.
Yeah.
Yeah. And then it's, salt can use, doesn't, they didn't write this right. Can salt, a lot of salty foods can elevate blood pressure. Also, tobacco use, alcohol use. So you name it. Yeah,
Yeah.
and yeah, awesome. Angry Quad, 10 different training routines.
Check out Angry Quad's channel. He's got a bunch of videos up, and um, if you need some motivation, someone to yell at you to get your ass in shape, visit Angry.
Mm.
But yeah, no, it is really good to be able to do that. And Leah was actually telling me, and I didn't myself look at the article or look it up. But she said that there was some information on like the higher level quads. And one thing about being on the vent, I think there was a way like the vent breathing, like actually controls the way it controls your breathing does actually strengthen your lung a little bit and like can help. And there was like some recommendations on how to try to elevate your heart rate, like as like a higher level quad that really couldn't move anything. So I'll have to try to find that and see if we could post that in future.
Yeah, and it's something to ask our high bank friends of Live to Roll, Dominic and Russ, and maybe we can put that in and do another show with those guys, and how they manage that. Because yeah, I get it when you're the higher levels and you can't do as much. Yeah, but there are certain things that it starts with diet, and then it starts with other things that keep you healthy and a healthy lifestyle, keeping the mind very very clear and very sharp, getting outside and not continue to have yourself stuck in bed every day, getting up and getting outside and getting that fresh air, getting that vitamin D, that is so awesome to your system. We all need vitamin D to keep those bones healthy in case, somebody just grabs you just wrong and you break a bone because of our bones weak. So,
Yeah, yeah, we could also. Um, but I was looking up, yeah, some of the statistics are right now too. So just saying like, um, the odds of heart disease was 4.1 times greater in individuals with SCIs. Oh well, that's actually I thought I was gonna say 4.1%, but 4.1 times. So four times more likely. Actually, that's a lot of for heart disease on that website. That's from the National Institute of Health. Uh, but but yeah, no, that's it's super important to do what you can, like you said, Bobby. Just get outside, get the sunshine, work on your diet, um, and I will try to look up and see maybe that'd be another good either show or just video to post for some information for people that how to maybe get your heart rate elevated if you are a higher level quad and can't even can't get your arms to move a bit to get that blood flowing. Um,
yeah, yeah. And, I'm looking at something, and this is something anybody can look up. It's on the Dana and Christopher Reeves Foundation or ChristopherReeves.org website about cardiovascular and your heart. But it says cardiovascular concerns are issues due to paralysis both from disease and trauma. Injury to the autonomic nervous system is the primary cause for cardiac issues after paralysis. Those with spinal cord injuries or disease affecting the spine at, and I'm kind of right, T6 and above, have an increased risk of cardiac issues due to the effects of uh, the ANS, which is autonomic nerve system risk factors, um, particularly to individuals with paralysis.
Okay.
So
Well,
some of it has to do with our trauma, I guess.
that is interesting, actually. Um, yeah, no, that's super. That is cool and interesting to know. Um, yeah. So, Bobby, you want to talk a little bit about now having AFib and some of the how that's changed you at all, and like kind of how like do you do you have to do anything now with diet, with routine, and all the stuff? Like, what does that all entail?
Yeah, basically, I'm just on a medication now.
Okay.
Uh, that's one for just keep the heart stronger and more, and to continue to stay in rhythm. But unfortunately, this medication is a medication that lowers your blood pressure. So yes, now I'll counter it by taking something that pops it up a little bit. So I'm on an upper and downer for my blood pressure, and I just take that twice a day. They're small little pills. They're the smallest dose. And luckily, since 2 years ago, I've never had AFib after. I do wear a Apple Watch um, that does tell me each week where if I've had an AFib attack, which I don't. And then the last thing I take is a baby aspirin each day, a bear, one of those bear
Okay.
baby. That, one thing about it is check with your doctor if you were going to do something about it. First, tell them the reason why, but it can thin out your blood a little bit.
Uh,
So during certain procedures, they're going to tell you to stop taking the baby aspirin maybe a week or two before a procedure that you might be having.
okay. And does that
Yeah,
uh,
good job.
that helps just with the heart and the blood flow, or is that like sort of a preventative for like
Thinning out the blood helps from that plaque buildup for
okay
your heart.
black buildup? Okay,
Hmm.
awesome. Yeah, no, that's good to know, and I'm glad that you haven't had any. Uh,
Yeah, me too. So
well,
even to a point where, like I think it was a year after taking this stuff, and I'm like, do I really need to still continue this? And he's like, yeah, I don't want you to stroke out. And I'm like, I'll do anything that tells me not to stroke out, not a problem. So, um, yeah.
yeah. Leah actually asked in the chat, does wearing your smartwatch impact your transfers at all when you're doing transfers, or impact anything you're doing, or have you
Hmm.
have you broken the watch at all or damaged it from wearing it all day, all the time?
Mm-mm. Nope. On my older watch, I had a bunch of scratches because I wear it on my wrist like this, and so it's underneath where it bangs. But I bought I think it came out 2 years ago. This is like the Ultra 2, which the screen is a lot tougher than the other watch or the normal watches. So the body it's made to take more of a hit. And I don't have one scratch on this. And I've had it now 8 months now. So for no scratches and still looking like it's in, almost like how I bought it, it's perfect.
Yeah, man, that's really cool. Actually, that quality. Hold on, I got Tom calling in. I'm just gonna
Sweet.
set
And then
that.
I can tell you a little bit about the having something like that. Hey, Tom,
Hey
What's up?
guys,
he made it.
can you hear me okay?
Yeah.
Yep.
Happy Tuesday.
Happy Tuesday. Glad you were making it.
How are
Um,
you? Go
we're
ahead,
good.
Bobby.
Yeah, I just wanted to finish a thought and then we can get in. But with the Apple Watch, there's two other things that go along with it. Not only that it's going to tell me if I might be an AFib, but it also keeps me very motivated. It's got these things called exercise rings and movements, and it will tell you. Sometimes I can be staring at my computer and doing some stuff, and it'll actually say, "Hey, roll around. It's been an hour." And so that kind of gets me away from my computer to roll around. And you get credit for that. And you get credit for how many calories you burn if you do an exercise, or how much, how many minutes do you do exercise. So it's got three rings: calories, moving, and exercise. So it kind of, looking at it going, oh man, I want to close my rings today. It's a good motivator to keep you going. And then not only that, it does have another thing for taking a moment of clarity and relax. So it's got some breathing things that I can do, and I can set the time for a minute up to 15 minutes of just breathing. So it doesn't tell you your blood pressure, but it does tell you your heart rate. And you can take your EKG with most of the Apple Watches now, I believe. Um, I wouldn't trust it 100%, but if it said that you have a bad reading, do what Leon said just a little bit earlier, that he just scheduled an appointment with his cardiologist.
I'm actually
You're
also
muted,
trying.
Shawn.
Yeah,
Oh,
sorry. I am actually trying to do the same thing. I did see a cardiologist for my first time last year because I had to get put under for the cystoscopy thing I was doing, or that was actually 20 ended. No, that was last year, last January. Um, but there was a weird thing on my EKG. My doctor sent me to cardiologist. They made me do like this stress test, like where they put me in like a MRI machine and injected me with stuff to pump my adrenaline and heart rate up, and it's kind of crazy. But I am trying to make another one to follow up this year, so I can make that a normal thing to do. Especially after learning some of these facts, now I'm even more motivated. uh, but go ahead.
what up, Viv? Hi, Leon, and everybody else. Sorry I'm a little late today, but I hope everyone's doing well. I'm not an old fogey like these guys, so other than being maybe a little broken, my heart's doing all right. Um, and yeah, heart health, baby. Honestly, it's not something I think about really ever. I mean, maybe I think about it when my blood pressure is like 190 over 140 and my head's about to pop. I wonder what my heart's doing, and maybe the damage I'm doing to it. But outside of that, just trying to regulate, make sure my blood pressure's okay. I have pretty good heart rate. I take my heart rate. I mean, when my nurses come, couple days a week. We do like vitals, just regular vitals. So it's like blood pressure, heart rate, temperature. My heart rate's pretty solid. Sometimes it can be elevated. Sometimes it can be a little low, depending on like my blood pressure and what's going on, like blood pressure wise. But generally, like I hover around like 60, 70 BPM, and I think that's pretty solid. Um, like last time I took it was like 66 or something, and I think for me, like where I'm at, that's okay. Sometimes it'll be a little higher, sometimes a little lower, just depending on what's going on with my body. Um, but yeah, I don't really know too much about heart health and stuff other than like eat healthy, don't eat a lot of salt. Cardio exercise is good for your heart. Cardio, hence the name. Um, and yeah, I should probably maybe do a little bit more cardio, but um, other than that, I don't know. I've been trying to be pretty reasonable with my diet and stuff and eat a lot of fruit, not have a lot of salt, but I love salt and I don't really hold back when it comes to consuming it. Um, at least like at this stage in my life, like again, I don't eat an abundance of it either. Um, so it's not like I don't really feel like I need to. But yeah,
Yeah, it's one thing, and like you said, what's like these old fogies, and you're right, we can when we're a little bit younger get away with some of that extra salt and stuff like that. It's just later in life um, that it catches up to you, and you said it right, Tom. You know how to reduce your risk of heart disease or cardiac problems is the first thing is diet, eating vegetables, fruits, like you said, and whole grains. A little bit uh, of fat-free, low-fat diet products like fish, poultry, beans. I eat a ton of beans. Nuts, eat a lot of nuts. And vegetable oils, limiting foods that are high in saturated fat, like McDonald's, and then limiting the sugar sweeteners, beverages, and sweets like those Coca Colas is, and then looking at your medication, asking your doctors can it cause any hypertension. Anybody who's smoking out there still in these days and day and age can have a risk of heart disease, and then benefits or exercises also big. Talk to your doctor about it because here at the bottom it said facts and figures. In the United States, 47% of all individuals have at least one of three key risk factors of heart disease: high blood pressure, or high cholesterol, and smoking.
That's yeah.
smoking's a big one, and I was just gonna say an easy one to identify and cut out, but maybe not to cut out, depending on how addicted you are to it. And even smoking cannabis, I think the act of like coughing can like really increase your heart rate, like make your heart like have a lot of do a lot of pumping and like have a lot of stress on it, which I don't think is good for it. So that's something to be mindful of, and kind of an obvious one. And I think a lot of people underestimate how much salt they eat too.
They
At least
yeah,
here in the
especially
States.
especially if you're eating out a lot and a lot of processed foods. There's so much sodium in all of that. Like if you actually try to look it up, I think it would surprise you because I just recently started doing that, and I'm like, damn, it's a, it's
Um,
hard to
well, salt is a preservative, so anything highly processed and like frozen and meant for like long term storage, that's one of the things that they do to help store it and keep it fresh longer is to salt it. So that's that's why, and plus because it makes it taste real good, which is probably the other reason. They, shove it full of salt, but um, yeah, just that's just like a real big one that I think is easy to identify and make a change. Um, some sodium's good for you, and in fact like some salt is like necessary for cellular like function and like our bodies to like run and operate. It's just anything in excess, so identifying like a healthy amount and making sure that you're staying within that range. You're not getting too little of it, but especially not too much.
Yeah, yeah, and and you said it just perfect, Tom. Also, salt is necessary for dehydration.
Yeah,
Especially if you're like myself, and everybody knows me on this show that I'm always reaching for my water bottle. I just overdrink, so I got to replace it with that salt.
yeah,
So I have to be careful, and if it's, I'm not sitting there gonna down salt. I'm never been a big salt person on my food. But so I take it in other forms, and I take one thing called Limit, which is a hydrator, but it also puts back the magnesium and the salt that I need into my body that I've starting to wash out. Um, so and there's and speaking of salt though, if you are one of those that like salt or like your foods, or you feel like your foods are bland, especially if you're trying to eat healthier or right. There's lots of other alternatives. There's lots of other spices that you can use. And there is, I know from working on the stroke floor at the hospital, there's a product called No Salt. It tastes like salt, but it's not salt. I've never tried it, so I'm sure that somebody can tell me like, yeah, that's a bunch of bull crap.
I'm
It
pretty
tastes awful. Maybe I don't know, but it's just something I heard that's an alternative.
it's like I don't know. I mean, I'm all for like gluten free stuff, but I've tried some gluten free items and like saying it's supposed to be like the real thing, and I'm like take a bite. I'm like, oh god, that's awful. Uh,
Yeah,
but whatever you got to do, and you said it. Like same with sugar and stuff. Like there's a lot of replacements out there um, that are similar and meant to kind of get you your fix if you're craving it, or if that's like something you enjoy, but it's also doesn't have as much of the bad stuff that we tend to like. So heck yeah, shop smart. I always say it, shop smart. Um, and if there is a similar product that is healthier and if not as good, nearly as good, then consider incorporating it more into your diet or whatever.
yeah. Angry said, no salt, no muscle function, and salt equals electrolytes. Absolutely.
Yeah, you just
Uh,
need to make sure not to overdo it and then hide it as well. So it's just like you got to find the right balance because that's what with anything, people you can't cut anything really out of your diet. You really need to have a balance of all, like you need protein, you need carbs, you need fiber, you need sodium, you need all these things. You just need to
yeah,
get them in
and,
healthier ways and balance them.
and a few people said, it's all moderation. Quad, Angry Quad, Leon. Yeah, everything is in moderation. Is it okay to go out there and have a McDonald's once in a great while? Absolutely. But if you're living off it as a means of because you can't cook, there's other means of how to get around that. So you're not trying to eat that. And one, I don't even know how anybody can afford McDonald's these days because my um, my grandson, geez, my grandson, he lives off that crap. I'm
Yeah.
like, have fun with it now because it catches up to you real quick. You can get away with it now, but it's not something you should live off, bud.
And yeah, Leah just in the chat said no salt's made from potassium. Potassium is technically they can exist in a lot of forms, but there is like a potassium salt, which I'm sure that's what it is. And a lot of these things are like important for cellular function. If it's not like NaCl, like if it's just potassium, or like Bobby said, magnesium and stuff. All of those things are pretty important for our body's cells and all the biological activity and function. Um, but that is good to know that it's a really solid option out there. It's salt, just a different kind of salt, which is cool.
Yeah, no, it is cool. Like we said, just make sure moderation, and especially if you have a disability, injury, anything, mobility impairment, it's just important to try to be somewhat aware. You don't have to track and monitor every calorie that goes into your body, but I feel like, make sure like what is higher in certain things, and if you want that, maybe balance it with like some fruit, veggies, on the other side. So
I wonder how no salt works before taking a shot of tequila if it does the trick. I'll have to try it out.
There you go. Another important thing that we don't think about is, check with your family. The family history has a lot to do with it. So checking in if, your grandparents or even ask your parents, how's your heart, how's your cholesterol, one thing is we're going in and Steve said it and Leon said it. And I'm just like that too. Angry Quad. I love Himalaya salt. Yeah, I love that stuff. Um, is We know about our sodium levels, but do you know your cholesterol levels? Are you looking at your HDLs and LDLs? That's gonna tell you, and it's something that as you start aging and getting over the age of 45, having a blood test once a year of just make, when you do a physical, seeing where those are. If it's increasing, you need to change some things.
And do an annual blood test, people. Do an annual physical. It's really important, especially if you have a disability. It's important if you don't have a disability, but especially if you're dealing with other factors and stuff. I don't care how rural you are or where you are, but make sure you get your ass to the doctor and get some blood work done at least once a year. It's really important. And I don't know, it's just make sure things are on track. Things um, can slowly get off course, but if you're regularly monitoring them, then it's much easier to know that things are getting off course at the start before things get real crazy and you have to take more extreme measures. But there's really there's medication for cholesterol and stuff, and you can like remind yourself and give yourself an idea of like, oh, okay, I gotta you know be more mindful of my diet. Oh, my sodium's really high, along with my cholesterol. Like, I need to, be more mindful about that. I need to get on some cholesterol medication or whatever it is, But there's only one way to know, and that's to go and get the blood work done and get an idea.
Yep.
Yeah, that's what definitely should be checking up with your doctor at least once a year annually for doing that kind of stuff. For
And I say that because I've gone like more than a year without going to the doctor.
oh,
Like, you're just like, you're just living life and in a groove and you're feeling healthy and you're feeling good. Um, I just know how easy it is for time to slip by and to go. Now I see my doctor a lot more regularly now just because I'm really trying to be more mindful and keep better like health progress, keep better checks on my health.
Hmm.
But at least once a year.
Yeah, and I think when you probably weren't doing it, you were in your 20s, right, Tom? Like myself, in your 20s, we don't think of those kind of things as we have to go through our doctor. But the older we get, it is something that we have to look, something to automatically make a point to see a doctor, get those checked out. Like you said, you should be doing it annually of a blood workup.
And I totally get what you're saying too, Angry Quad. That is just a snapshot. Like if I ate a bunch of In and Out burger and like was out partying, the night before, and I went and got some blood work done on a Monday. Like you bet your bottom dollar it's going to show up like not looking maybe so good compared to like if I was just really like taking it easy and like very mindful of my health and stuff like at the time. But it can also highlight things that do change more like consistently over time, which is like cholesterol and stuff. Like it's certainly a snapshot of that particular moment at that time, but it can give you an idea of things that do change a little bit more slowly. I think it can still be really, really important, and it can be indicative of bad habits. Like if you go in, and things are high, it certainly could because you just were eating not so healthy the last few days, but that could also be kind of a more regular trend in your life, and maybe a reminder that hey, maybe I should consider some lifestyle changes that might, improve these numbers.
And you're right, it is a snapshot for a second or of that day. But here's the thing: is you get to have a pattern. If you're not going in on a regular basis, they can't look back in your chart and go, well, 6 months ago or a year ago,
Yeah.
it was high and now it's high again. And then the third time it's higher. Okay, now we got a track record. That's
Yeah.
why it's important to do that, because might be, but if you're seeing it time and time again, then we know it's not that one time thing. And, unlike, like my doctor will do is, and Steve said it, or a bunch of people said it too, low sodium for those that are drinking lots of water. And so there's times when I've gone in and he goes, sodium's a little low today. So I'm going to reschedule a blood panel for you in a month, because it could be a snapshot. You're right, but we already have a history of you, Bobby, that it ends up this way. So let's just check it in a month. So if a doctor thinks that it's going to be, um, if it's just a one time thing, you might not worry about it. But if it's something you're doing all the time, then they're going to get worried and probably look into it.
Stress, I think, is something that's really important that was brought up earlier. I think, or at least I saw some comments related to it. I'm a fucking stress case 24/7. I've been trying not to be, but man, I'd be stressing about things I don't even have a need to stress about. But sometimes that's how I am. I do a lot of techniques to try to de-stress, not stress, not worry about things, especially things that I don't necessarily have control over. In that moment, it's something that I do try to work on regularly and pause and do some deep breathing and just try to self-regulate. Um, but I think stress is probably the one. Well, maybe not the one thing, but is something that I know is not really healthy for my heart and something that bugs me and plagues me a lot. And I don't know. We live in a really crazy world, and life can be a little tough at times, or a lot tough all the time. It can feel like sometimes. So, yeah, I'll be breathing, um, and I just try to when I mean sometimes it's like nowadays like oh I just need to take an edible and chill out and that's what I'll do before it'd be like oh let me take a hit of weed, try to chill out and not feel so stressed, but again smoking I think can be just as bad or worse for you in regards to heart health even if it's cannabis, so that's not really a viable solution to getting into a less stressed out state of mind. And I don't know, most of that for me is just mindfulness. Just try to take a moment, understand and realize that I'm stressing. And usually it's, like I said, a lot of times it's about stuff that I can't even necessarily control or change in that moment. So, I just try to take stock of that and get out of that stress state of mind by doing something that I enjoy, hopping on and playing some video games and forgetting about, whatever it is that I'm stressing about, or call up a friend, or, read a book, or, put on a show or something peaceful and listen to an audiobook and just de-escalate the stress.
Yeah. Um, and here's something important. And Angry Quad just asked, what are your cholesterol levels? And here's something important. I'm trying to find exactly mine because it's uh, I keep my chart. My what's that called? Oh, my brain is just not working. Mine's called my chart, but it's where I can see all my test results and all my appointments I can make, and so every blood work I've had by my doctor, I can go in and check it.
Most like the lab places like LabCorp or Quest or I don't know, like those are at least the ones that I'm familiar with. But most places where you get labs done now, they have like an online portal or like something that you can register and sign up through to access your results. So you don't have to necessarily wait for your doctor. It even highlights like if for me on my chart, like if it's a good number, it's highlighted green. If it's a not so okay number, it'll be highlighted like yellow or red, depending on like how extreme it's off from like the average or the normal. So it can even give you an idea of like numbers that aren't so good or numbers that are good. Most of the time, all my stuff is green. I think the last time I did blood work, my my B12 was really really low, but I just got a B12 shot and have been taking some vitamin B supplements to try to up that. And why it's low, I don't know. Maybe just because I wasn't incorporating enough foods in my diet that had B vitamins in it or whatever. Um, so I think that's cool to be able to access your labs and to just have an idea for yourself what's going on. I don't know the cholesterol number off the top of my head, but I have never had um, high cholesterol thus far that like my doctors highlighted or I saw was concerning. So
Yeah, I just looked at mine. It's
I,
normal range.
I actually don't know what mine is, so I'll have to pay attention on my next blood panel and stuff. I don't think I've never been told I've had bad cholesterol or out of. I've always been within normal stuff. So that's all I know is every time when I get panels done. Yeah.
well, high cholesterol isn't necessarily always associated with people that are overweight, but that generally it is. And you're such a skinny mofo, Shawn. Um, yeah.
Yeah. So you're saying I don't have
Well, yeah. I mean, I've never seen you like eating an abundance of super unhealthy food that's leading to like weight gain and high cholesterol or anything like that. So it makes sense that you've had decent numbers, just kind
yeah.
of based on your physical.
Well, I've never overeaten. I've never been an overeater. I've gone through phases of eating a little healthier or not, but most of my diet has been a lot of sodium rich processed foods for a lot of my injury. Now I am trying to have a little bit more mind for health and tracking that stuff and keep them. But yeah, I've always been skinny and like I did just kind of eat whatever. Like I didn't care, but I never overate like crazy. I've just but for me it's been hard. Like unless I would be really like smoked a bunch of weed and had super munchies, I always have had trouble eating. So, which again, which is weird. Another thing that I've mentioned once before, since I've stopped smoking in the day and just doing edibles, I have a way stronger appetite throughout the day. I have no idea
Oh, funny.
what I used to like think I had to smoke before I ate food, and now I'm just like, damn, I'm hungry. Give me food. Just kidding, not like that, but like like I just get hungry. Like I'm like, dude, like I'm ready to eat. Like
Give me some food, damn it!
so
Um,
it's just yeah, it's crazy how that all works. But anyways,
it's funny. I did read an article one time on how the it it can be a common side effect for like cannabis is like to increase appetite, and it's actually like one of the reasons like it's really good for like cancer patients, people on chemotherapy, or things that make like kind of suppress your appetite. But I also read an article once on how cannabis can suppress your appetite too for certain individuals, and it's not like a common thing, but it is a side effect for some people. So I'm wondering if that had any effect, or I mean, it's just kind of curious. But I do remember reading that one time. I have to look it up and look into it a little bit more. Hi, Daryl. Great to see you too, dude. Hope you're doing well.
Yeah, and that Jay Willie said, I can't eat a lot because of my disability, and I think that happens to a lot of us. Some of us are just not big eaters. I don't force it, but I just make it a point But I can get up in the morning and not eat,
I
just
used
not
to,
eat.
I mean, I've always been kind of chubby my whole life, just like a chunky boy. But like before I moved out, like when I was like 18, 19, 20, like I was pretty big. I was like 180, 190. I was like a husky Tom. And I don't know, when I was living at home, eating, like my family's food, like my parents are pretty health conscious, but my parents like to eat good. Like my family always ate really good, and I did not hold back. And I ate a lot, and I ate a lot of good food with a lot of butter and a lot of fats and a lot of salt. When I moved out, that changed. I went from being at home to like just endless good, delicious, fatty food, to like being on my own. I was on like a meal plan my first year I had lived out, like moved out and lived on my own. But then I got to just like preparing my food for myself, like fending for myself, eating out, doing my own food prep and stuff. And I lost a lot of weight. Not because I wasn't eating, but I just wasn't eating as much or maybe like as rich of foods all the time. Um, you know, I wasn't starving, but I also just wasn't eating as much, which I don't know, I lost like 30 or 40 pounds. And I don't know, I'm at a really healthy weight. Like I got a belly. I'm certainly not like super skinny. Um, and I found like a good balance in my diet. I think I used to a couple years ago was like eating out a lot. Um, I've curbed that habit and eat more at home and like prepare more food. And I'm telling you, that's just like a really, really, really great way to be more mindful of your health and take more consistent action. Is prepare your own food, you guys. Eat out less, go grocery shopping, and come home and cook. Um, it makes a world of difference. Shawn said it earlier. Eating out all the time, there's just so much fat and butter, and fast food and stuff. So much fat, so much salt. Um, and even the act of cooking too, I think, can be like a healthy thing for you. It's moving your body a lot. It's at the very least you are thinking about the things that you're going to be putting into your body a lot more when you're preparing it, when you're cooking it, versus someone doing it for you. Um, and not everyone's in position to cook themselves or cook all the time, but you can still be involved in food prep, especially with, grocery shopping and things like that. Thinking about the ingredients that you're buying and what you want to have prepared for you. Um, so yeah, I think that's a really important thing to consider and really good way to take action on your diet and your health is being a little bit more involved in the food prep and not eating out so much.
Especially if when you have a caregiver or someone making your meals. There's I find on Instagram some of these stories where um, a person will like uh, do a crock pot of this stuff of chicken and then beans and blah blah blah, and you make a burrito and then you freeze them and you have all these healthy burritos, not the ones you get at the frozen at your supermarket frozen food aisle that has probably so much saturated oil and all that. But it's your ingredients, it's what you use, and you can freeze it and you can have it at any time with
Yeah,
some you know
The meal prep stuff like that is super good. I think really really helps because it is hard to maintain all that. Like for me, I am fortunate to have a wife that likes to cook and cooks really good. Uh, and that's what she does. She'll cook a bunch of chicken and then we'll freeze some of it, keep some like it's just we're trying to have food on hand and like chicken or roast and stuff like that. We do also and freeze and keep for. But that's the way you can kind of have somewhat quicker meals. So if you have somebody that can help you maybe once or twice a week meal prep for multiple days, that's a great way to eat healthier, I think, for sure.
yep.
Yeah,
Meal
yeah.
prepping is smart.
What one of my
I was just
favorite.
gonna say, you don't
Go ahead.
always have time during the week, but like on a Saturday or Sunday, set aside 4 or 5 hours and cook up a bunch of chicken, cook up a bunch of rice, cook up a bunch of beans, and put it all in Tupperwares and keep for eating during the week. It's just super simple. All right, sorry, Bobby, go ahead.
No, no, that's okay. And I probably lost my train of thought. What I was going to say. Um,
Damn it, Tom.
oh, one of the things I do like is a white chicken chili uh, uh, for dinner. We make a big tub of it, and it stays around for a long time, and it's just easy to heat up. And lunch and dinners when you're not sure, and if you like something and it's healthy and it's good, make a lot of it, and then you always have it.
JJ, I don't know if there's any good sites I recommend for simple meal prep recipes. If you're running into stuff that's too fancy, just Google simple meal prep recipes, and hopefully some simpler ones will pop up. And you may have to sift through, things that look a little bit more complex or a little bit beyond fancier than what you're looking for. But I promise you that you can find some really simple stuff online. It's just what Bobby said. Mini burritos. That's one of my favorite things to meal prep with my sister. We'll not even cook up chicken. We'll get a rotisserie chicken at the store. Just deconstruct it, pull all the chicken off, cook up some refried beans, do little veggie fajitas with some peppers and some onions. Bing, bang, boom. Make up a bunch of little mini burritos you can freeze for during the week. Those are awesome. Bobby said it, like chilies, any kind of like stews or like, even soups and stuff, like meal prep real easy and are super easy to cook in abundance. Um, I like curries and stuff like that, like, like chicken curries with like some potatoes or some cauliflower or some other veggies in there, and then cook up a couple servings of rice. Easy to cook up, like 5 or 6 portions of rice in a rice cooker, and just add them together in a Tupperware. Bing, bang, boom, you're good to go. And I could go on, but if you want to find out more cooking ideas, you're gonna have to tune in tomorrow at 3:30 for Cooking and Life Skills with T Fizzle.
Bam, made a new banner.
Yeah.
Boom!
Picking the sky.
Oh, look at
I'm still missing an arm, but we're back, baby.
You don't need that arm, bro. Fuck
I
that
don't need
arm.
that arm, dude. Fuck that arm. Thank you, Shawn. I appreciate you making up the new banner, dude. And I've been having fun the last couple weeks cooking with you guys. So we'll be back tomorrow with some more meal prep and some, just like what the banner said, I'm going to try to incorporate some other independent living skills and stuff into the videos. So if you feel like coming and hanging out, I really encourage you to do so.
Yeah.
And JJ, real quick with your meal prep, I find them on Instagram. Like, go to the search, put meal prep, healthy meal prep, and the videos there's just tons. And your best friend of having multiple meal preps, your crock pot. For those who have crock pots or someone that can manage it. So that's a lot. And Tom, I just saw an article. I didn't read it, but tuna from Trader Joe's, and there was a couple other ones. I should have sent it to you. Yeah, be careful. It's got they're having a recall on it. I thought of you. I'm like, oh.
Well, I've been okay since the last time I had tuna, so I think I'm doing all right.
Yeah, you're still here.
I do try to be like mindful, like mercury and stuff. They say don't eat like fish more than once a week, or like certain fish more than once a week. The tuna that I get, it does say it's like the lowest tested mercury around. For, I mean, whether that's true or not, but I appreciate you point that out. We're gonna be doing tomorrow. I think we're gonna pre-bake the potatoes. We're gonna be making up some baked potatoes. We're gonna be doing some other fruit prep and some other stuff. So yeah, make sure you don't miss it.
Yeah, make sure to tune in tomorrow. Hang out with Tom.
Oh,
And on Thursday, I tried to update all of them. We got Rolling Over the Hill and the little bit of a new panel crew. Not new, still Bobby and Robert, but now Paul and Chad will be joining them on the second and fourth Thursdays of the month. And Luis will still be around to fill in. I even offered if he wanted to come fill in a little bit today, but he's just been busy and doing a lot of stuff. So still part of the channel, but we're just kind of revamping a little bit some of the stuff here. So we got that coming up on Thursday. Make sure to come in, tune in, hang out. And then next Thursday, we'll have Wheel Girl Talk with Brianna, Nikki Ashley, Maya, and Jessica. So make sure to tune in and check them out next Thursday. And we will also be back for another one on Tuesday as well. So make sure to tune back. Be back. And I think next week we might be talking a little bit about the dating, sex, intimacy, and stuff like that with Valentine's Day upon us, I guess, to see that time of the year. So, yeah,
it's always one of our more popular shows talking about sex. So make sure
and I
it's
will
bound
also
to be sexy.
we also have one more show the first Thursday of the month, rolling with the Golden Oldies, and Mickey asked me to take her off the banner for now because she's having some health issues and not on there. But make sure to tune in. Some awesome ladies giving some great advice. They actually just talked on Tuesday a little bit about kind of love later in life and dealing with loss later in life, because Ellen had just done a divorce and Julianne just lost her husband last year too. So they kind of talked a lot about that kind of stuff. It was a really good show if anybody wants to go back and check that one out from last Thursday. But all right, guys, that's all the shows. I didn't actually even do our sponsors. So let me thank
Tom,
our sponsor.
or Tom, what time's your show tomorrow? Somebody's asking.
3:30, 3:30 Quad 4G. You got the time right. It'll be the same time as our Tuesday show. So yeah,
3:30 Pacific time, 6:30 Eastern Standard. So he has.
yeah. Appreciate that, Sean. I didn't see the EST there. Yeah, 3:30 Pacific. But yeah, tomorrow we're doing a good dinner food. So if you're tuning in on Eastern Standard Time, it'll be perfect dinner time show to tune into.
Awesome. Yeah. So everybody tune in. Make sure to check that out next week. And then also, again, shout out, thank you to our sponsors. When do you guys want to do it? Or you want me just to.
Mobility professionals. Shout out mobility professionals. If you're fortunate enough to be in Southern California, they got you on anything and everything DME equipment, wheelchairs, standing frames, shower chairs, and the like. They got you, and highly encourage you to give them a follow up if you are struggling or looking to get a new wheelchair or just needing some DME supplies and equipment. Their sister company, Urology Professionals, can help you out with everything catheter supplies, and anywhere in the US of A, they can get you hooked up. They are national, only the Urology Professionals. You got to be local for Mobility Pros, unfortunately. But if you need regular, consistent catheter supplies for little to no cost to yourself, go give them a call. They'll help you navigate the insurance side and get you the supplies that you need.
Yep, definitely a good company and great people that help out. Our friend Dean, friend of the channel and friend of the community. Uh, so yeah, we appreciate their support and thank you guys for checking them out if you do need anything. All right, guys. So thank you again for watching. Make sure to tune in tomorrow. Check out the cooking and life skills with Tom. And Thursday, Bobby, Robert, and the crew will be back for the rolling over the hill. And we'll be back next Tuesday. So make sure to say subscribe, click that bell if you want notifications. And we'll see you next time. Live to roll, everybody.
Live to roll.
After all.